Hi friends, welcome to my YouTube channel. Today I explain about very important heart disease, myocardial infarction. If you watching our video, please like, share and subscribe my channel. Okay friends, we'll start with the video. Myocardial infarction. Myocardial infarction refers to the process by which myocardial tissues are permanently destroyed in the region of the heart that are deprived of an adequate supply of blood, myocardial ischemia, because of a reduced coronary blood flow. Subsequently, necrosis or death to the myocardial tissues occurs. Clinical classifications of different types of myocardial infarction. Type 1, Type 2, Type 3, Type 4, Type 5. Type 1 spontaneous myocardial infarction related to ischemia caused by a primary coronary event such as a plaque fissuring or ruptures. Type 2 myocardial infarction secondary to ischemia resulting from an imbalance between oxygen demand and supply such as coronary spasm. Type 3 sudden death from cardiac disease with symptoms of myocardial ischemia accompanied by new ST evaluation or left bundle branch block or verified coronary thrombus by angiography. In this type of myocardial infarction, death occurs before blood samples can be obtained. Type 4 myocardial infarction associated with primary percutaneous coronary intervention. Type 5 myocardial infarction associated with coronary artery bypass graft. Etiology: reduced blood flow in a coronary artery due to atherosclerosis, increased oxygen demand and decreased oxygen supply. Complete occlusions of an artery by an embolus or thrombus. Sudden narrowing of a coronary artery. Acute blood loss. Anemia. Risk factors. Modifying factors. Hyperlipidemia. Smoking. Hypertension. Diabetes mellitus. Physical inactivity. Obesity. Stress and type A personality. Lack of estrogen in women. Non-modifying factors. Family history of a CAD. CAD means coronary artery disease. Age, gender, race. Precipitating factors. Emotional stress and upsetting life events. Surgical procedure associated with acute blood loss. Cocaine use. Thyrotoxicosis. Increased myocardial oxygen demand secondary to tachycardia, fever, agitation, hypoglycemia, pulmonary embolus, myocardial trauma or stroke. Degree of damage. Different degrees of damage occurs to the heart muscle. Zone of necrosis, zone of injury, zone of ischemia. Classifications. According to the layers of the heart muscles involved, myocardial infarction can be classified as transmural Q wave infarction, non-transmural subendocardial infarction. Location of MI means myocardial infarction is identified as the location of the damaged heart muscle within the left ventricle or right ventricle. Left ventricle infarction, right ventricle infarction. Clinical manifestations: chest pain. Characteristics: pain in substernal is severe and differs is crushing and squeezing, may radiate to arms, neck, shoulders, back and jaw, is not relieved by rest or nitroglycerin and lasts longer than 30 minutes. Patient may be anxious and restless. Cool, clammy and moist skin and facial pallor. Heart rate and respiratory rate may be faster than normal. Decreased cardiac contractility and cardiac output. Dyspnea, palpitations, extreme fatigue, nausea and vomiting, epigastric or abnormal distress. Means abnormal abdominal distress. Disorientation, confusion, fainting. Oliguria, decreased urine output. Marked jugular vein distinction. Fever, evaluated temperature up to 100.4 degree Fahrenheit to 102.2 degree Fahrenheit. Hepatic engorgement and peripheral edema. Vasoconstrictions of peripheral blood vessels. Diagnostic evaluations: patient history, electrocardiogram, angiography, cardiac enzyme test, CKMB and LDH1 and LDH2. Radionuclide imaging. Positron emission tomography. Other finding: evaluated WBC counting, evaluated myoglobin, elevated cardiac troponins. Medical management. The goal of medical management is to minimize myocardial damage, preserve myocardial function, prevent complications. Oxygen therapy, thrombolytic therapy, analgesic therapy, vasodilator therapy, angiotensin, beta adrenergic blocking agent, calcium channel blockers. Surgical management: coronary artery bypass surgery, percutaneous transluminal coronary angioplasty, coronary stent, atherectomy, transmyocardial laser revascularization. Okay friends, how is the today videos? If you like the video, please like, share and subscribe my channel. Please follow my channel for interesting videos. Bye friends.